As you probably know, I've been doing implants quite a bit and have had some experience with changing implants that I've used over the years. And so I've had a lot of experience with a lot of different implants, all the major brands and some that weren't major brands over the years. And I found out, just kind of looking back at my history, that it seemed like we would change implant brands or implant um, types within a brand every few years, and it was kind of rare to go 5 years or longer before we wouldn't switch and do things. And maybe it's sort of like cars. After you had a car for 4 or 5 years, it's time to get a new one, and there's just new technological advances. So I just wanted to say that up front because I know where you're coming from, that there is just a natural resistance to want to change. It's so annoying. You have to not just change your own heart, but you have to change your restorative or surgical team, your assistants. It's just a pain. So I just wanted to kind of mention that in my history, just so you know, I empathize with that part. When I was looking at technology, though, and I understand that the doctors on this call are very technologically driven. We understand that you like to use the latest and best technology possible. And so I have been involved in two technologies that interested me enough that we decided to form a dental implant company. And the technologies have to do with an antimicrobial technology that will make the surface of any product so that bacteria can't grow on it. And that's really a shocking thing. And I've been involved with this company called Novio, Nobio.com, for the last 5 years. And now I am vice chairman of the board and one of the major shareholders in this company. And so as I thought about this technology and the importance it might be in dentistry at large, I looked at my implant experience over the years and realized that there were a lot of complications that happened a lot of times fairly late, 4 or 5, 10 years out even, where the implants would become infected and become lost, or bone would be lost and cause aesthetic problems and different aspects of problems. And so I realized that peri-implantitis was an important thing about implants that we haven't solved yet. And so being on the board of Nobio, I thought, okay, I think what dentistry needs, the way I can help patients, the way I can help the professions at large, is to develop an implant company that would go towards this technology. And you might think, well, this is not possible. We'll never be able to get it through the FDA. Well, Nobio has 4 dental restorative products coming on the market in January. They're all composite restoratives or adhesives, but they're going to be in the mouth, and they retard plaque formation and, of course, recurrent caries around fillings that are placed. And so it doesn't take much to connect the dots to see that we can do this kind of things in almost any material that you can think of that could be used in medicine or dentistry or even in industry. So the major reason behind starting this implant and company is to help patients and help doctors to solve this problem of peri-implantitis, which occurs about 8 to 10% of the time, and in some practices up to 20% of implants placed. So that's number one. The second thing is I wanted to select an implant company, the top implant company I could find in order to put this technology on, and that turned out to be Ditron. And Wayne is going to tell you a little bit more about Ditron. But Ditron is a 50-year-old company. The implant portion of it's maybe 10, 12 years old. It is the most precisely manufactured device in existence. And so Ditron Automotive and Aerospace creates the most exacting manufacture of precision parts in the world. And we have here with the Ditron implant the most precisely fitting tolerance between the abutment and the implant. Why is that important? Well, one of the areas where bacteria is harbored is between that fitting between the abutment and the implant. The tolerance level is down to 1 or 2 microns. 1 or 2 microns. So the goal being to basically almost have like a one-piece implant there. Now, a very, very small bacteria, one of the smallest bacteria is P. gingivalis. That's 200 or 2 microns in size. So that bacteria couldn't fit in a 1 micron gap. So you get that. That's kind of where we're coming from. And there's some other design features I want to talk about. But these are the generation of this company, and what we're trying to do is not just create a value product that's less costly and so on, easier to use and so on, but to really to help the doctor and to help the patient.